Time to answer some common health questions. Joining me, as he does every Wednesday, News Channel 5's medical expert, Dr. David Soria. When he's not hanging out with us pre-Turkey Day, he's the Chief of Emergency Medicine at Wellington Regional Medical Center. Thanks for coming in.
You're welcome. Good to see you.
All right. Well, because it is the day before Thanksgiving, we are focusing on some Thanksgiving-related questions. So here's number one. How do you know if you have food poisoning?
Yeah, well, food poisoning is really a combination of three things. You have to have the nausea, vomiting, you have to have diarrhea, and you have to have abdominal cramping. But a lot of people ask, well, how do I know if it's food poisoning versus the flu? And the reality is it's very difficult. The symptoms are essentially the same. Come on about the same, leave about the same, typically resolve in about 24 to 48 hours. The way we tell is just by history. We ask you questions. Did you eat any contaminated food? Could you have had any contaminated water? Have you done any recent travel? Things like that. There's no quick tests that'll give us a difference. But it's okay. Treatment is the same. When I want you to come see us is if you have a fever, if you have bloody stools, or if you have signs of dehydration, meaning you're getting lightheaded, lips are chapped, mouth is dry, or if you have diarrhea for greater than 72 hours, or you just can't stop vomiting enough to drink down some water or fluids, then you're at risk for dehydration. Come and see us so we can get an IV.
All right. Here's our next question. A lot of us binge eat. But how common is binge eating, and should we be concerned about this? You know,
it's actually a lot more common than a lot of people think. It's 2% of the population, which is over 4 million of us that actually binge eat. But 15+% of the obese population binge eat. But what is a binge eating disorder? Well, essentially it means that you eat large amounts of food in a 2-hour time frame, and you keep eating despite being full. You just can't stop eating. So it can be significant. The reality, though, is that it's one of the kind of unique disorders where it's substantial in men versus the other eating disorders, which are much more common in women. So when does it become a health problem? Well, typically it's unhealthy in general to binge eat and to gain weight, but it can cause other diseases such as hypertension, diabetes, high cholesterol, heart disease, and gallbladder disease. So if you feel you fit the profile of binge eating, and by the way, it's not eating tomorrow and one meal. It is at least 2 days a week for 6 months, you may have a problem. Make sure you get it checked out.
Okay, because I was going to say, now look, do we all need to make appointments with you after tomorrow? Because that could be rough.
I think we'd all have a disorder after tomorrow.
All right, thank you, Dr. Soria. And if you have a question for Dr. Soria, you can send it in by going to our website, WPTV.com. Click on the health link and then scroll down on the right-hand side. You will see that form to write in your question. Happy Thanksgiving, Dr. Soria.
Happy Thanksgiving to you and to all of you.
Thank you for coming in, and we will see you after the break.